Hi, I'm Ken Cutbush. I'm a shoulder surgeon working in Brisbane. I'm going to talk to you about the risks and potential complications of surgery for proximal humeral fractures. So what we're talking about is something that looks like this. There's a proximal humeral fracture. It's a fracture through the proximal humerus. You see the tuberosity, fracture line across here. And this has been fixed. It's one of my patients, been fixed with a plate and screws. And that's what we're talking about. When I talk to people about the risks of that surgery, what I talk about is the risk of infection. There's about a 1% risk of infection. That's significant. You need to think about that. There's also a risk to the axillary nerve. The axillary nerve comes round the proximal humerus here, and it goes to the deltoid muscle. You can actually see that muscle there on the X-ray. It's this muscle here. It's very important. The other risks are the avascular necrosis to the humeral head. The blood supply to this bone here comes through here because this is covered in cartilage, so the blood supply has to come up. The fracture cuts that blood supply off. It has to regain that blood supply and revascularize it. If it doesn't, the bone dies, which we call avascular necrosis. And then you get collapse, and often you'll need things like a shoulder replacement thought of. There's also the general anesthetic. A general anesthetic needs to be thought about. There are risks from a general anesthetic. Now, if we put some science behind this, there are two articles I'm going to draw your attention to. These two here, Sproul et al. In Injury in 2011, and then Kavuri in the Indian Journal of Orthopaedics in 2018. Both are big reviews of the available literature talking about the risks and complications of proximal humeral fractures. The QR code there will take you directly to the publication if you'd like to go and have a look and read it yourself. Now, reoperation rate was 14%, so you do need to think about that. 14% of patients needed further surgery to deal with their problem. Complication breakdown. One of the big things is intra-articular screw penetration. We use locked screws. That means there's a thread for the bone and a thread for the plate itself. So the screw locks to the plate, so it's a rigid construct. So if you get settling of the humeral head, it can settle down on those screws, and the screws can penetrate through the bone into the joint itself. So that is something that's usually simply looked after. You just remove the screws, but it means another operation. Collapse of the humeral head. So the humeral head can collapse, as we mentioned. So that was almost 7%. Subacromial impingement. So sometimes these structures, they don't fit back quite right. And when you lift your shoulder up to the top, you're hitting on the acromion here. So it's called subacromial impingement. So when you raise your arm up to the side, this has to swing under this ledge of bone here. If it catches, that's called impingement. Avascular necrosis, I've mentioned, occurred in 10% of cases. So it certainly is something to think about. That avascular necrosis isn't necessarily related to the surgery. It's related to the actual fracture in the first place. The surgery often actually decreases the risk of avascular necrosis, but it doesn't eliminate it. Non-union, the bone itself may not join up. That can happen. You might need bone grafting. It might need to be redone. And infection, of course, whenever we do an operation, there's a small risk of infection. They're quoting a risk of infection of 1.4 to 4%, and that's relatively high. Just a little bit of background. Sproul et al., they looked at a big meta-analysis. They looked specifically at 12 articles encompassing 514 patients. Kavuri et al. Looked at 57 journal publications involving 3,422 patients. So these are big reviews, and this is a pretty reasonable summary of what the risks of the surgery are. Thank you for listening.